Hi there, how are you? I just wanted to take a few minutes to send you this video to let you know that I'm super excited about welcoming you into our family. But before we did that, I really wanted to have a serious conversation because whenever you have surgery, it's a serious decision that you're making. I want you to take a look at not only the benefits, but also some of the risks and complications that can occur. Again, these are far and few between, but they can occur. And when they do occur, we have to have different types of treatments to resolve these issues, and it may involve more than one surgery. We just don't know. But thank God, these can be rare. So when I'm talking to you, I want you to really read your risk and consents that we've got in there. It can be pretty scary, and it tells you everything, all the way from just having a simple complication to having something that can be very serious. So I need you to really take a look at everything here. But again, these are all really rare, and they could happen to anybody. I don't care who's operating on you. I don't care who the patient is. These are things that could happen. Again, rare, but I want you to understand them. The first thing that everybody is concerned about is infections. Infections can occur. They can be minor or they can be major. But typically, we try to prevent this by giving you antibiotics beforehand, giving you antibiotics after surgery. We're keeping an eye on it. We're watching for different signs and symptoms like fevers, redness, tenderness. So we always have our antennas up for that. It's not something that I forget about. I'm always doing things proactive. How do I prevent it? And when it happens, are we ready to deal with it immediately and be on top of it? And that's what we do. So we're always thinking in the future. I'm always thinking what if. So infections is number one. That could happen. It doesn't mean that anything was done wrong. It just means that you ended up getting an infection. Number two, bad scarring. Bad scarring comes from two things. Either your genetics, I really can't control that, or suture reactions, which has nothing to do with us. That's just your body saying, hey, I don't like this kind of suture. And you never know which suture is going to react and which one not. So whenever you get a bad scar, an unsatisfied scar, we can treat it by cutting it out, putting some steroids in there. There's a variety of different options like lasers, tattoos, etc., etc. But bad scarring is out of our control. Now, number three, whenever you do liposuction, you can get a few things. Number one, skin burns. So we have to be a little bit conservative whenever we're doing our lipo. And sometimes I can't get as much out as I'd like to because I got to play it safe for you. I got to try to keep it safe. Even sometimes when I'm safe, those things can still happen. So these are all possibilities whenever you're doing liposuction. Also, irregularities with liposuction. I'm removing the fat, and sometimes your fat can be really hard. It comes out in clumps, so you can leave little irregularities and divots. If you get these irregularities, I can try to improve them by different techniques. Like one of them is called Safe Lipo, and you can read up about it on the internet. It's a technique on how I remove fat and how I respread it. You can then put a little bit of fat. You can use some skin tightening lasers. So there's a few tricks that we can try to do, but it would revolve around a second surgery, sometimes third, and sometimes your body just doesn't want to respond and we can't fix it. When you're doing liposuction, you can get fibrosis. That's internal scar tissue. So massages are going to be really important. But no matter how much care we take, no matter how much precautions we take, that could still happen no matter what. That's your body's way of reacting to the healing process. And if you get this, you're going to have to do lots and lots of massages, and it could take 3 to 6 months for that to kind of improve and resolve. So these are all things that, thank God, don't happen as often, but we're ready for them and we're trying to prevent them. There's a lot more of these things that you need to read about in our risk and consent forms, but I got to tell you, one of the things that I'm thinking about always is safety. That's why I'm a president of the Safety for Surgeons, and I'm always thinking, how do I prevent? And then what do I do if? I always have a plan A and B and C. So I'm here for you. I hope you do become a member of our family, but please read all the risk and complications, and I'm here for you.